Good afternoon and welcome to this Lyme Disease UK seminar. Thank you to the many people who have registered for this event. We've been overwhelmed with registrations. We hope you'll find it informative and interesting. We warmly welcome Professor John Lambert, consultant in infectious diseases from the Mater Rotunda Hospital in Dublin, the University College of Dublin Medical School and lead trustee of the Lyme Resource Centre charity, and Monica Wilde, MSc, who is a research herbalist and leads the Napier's Lyme Clinic in Bathgate. Thank you both so much for sharing your expertise with us. This seminar is being recorded and will be shared at a later date, so don't worry about having to write everything down that everybody is saying. Please stay muted throughout the seminar so that the speakers are not distracted. Both speakers will give roughly a 10-minute presentation about their approaches to treating Lyme disease, and then they will take some questions that have been submitted prior to the seminar. We are hoping to take a couple of questions from the chat box at the end, but if we don't have time, we apologise. Please bear with us if we have any technical glitches, and if we do, we will try to resolve them as quickly as possible. I hope you enjoy this seminar and that you find it really useful. So I'll hand over to Professor Lambert. And would you like to speak first, or do you want me to bring your slides up straight away?
So you can go ahead and put the slides up right away. That would be great. Okay, so good afternoon, everybody. And I'm going to just do a brief slide presentation overview of Lyme and my approach to treating Lyme and co-infections. And hopefully it'll take 10 minutes and leave time for questions. Thank you.
For some reason it muted you when I tried to share your slides.
I don't see the slides here. Are they, have you found them?
I'll share them again, but as soon as it started to share, it muted you for some reason. Right. Can you see them now?
See. Yeah, there we are. I've got them. Can you hear me?
Yeah, I can hear you, and I'll just mute myself while you're talking.
Okay, so I go by Jack Lambert. So I'm just going to talk about treatment of tick-borne infections. Next slide. So this is just the background. So in order to kind of advocate in Scotland for more support for patients in Scotland, we've established the Lyme Resource Centre, and the website is listed here. Next slide. And we talk about Lyme disease, but it's not just about Lyme disease. Lyme disease is first described Borrelia burgdorferi sensu stricto. But as you know, there's lots of strains of Lyme, Borrelia, and the European strains are different than the American strains, and ticks carry many other things besides Lyme disease. And this is a list of all the different things from bacteria to viruses that ticks carry. And in Ireland, the vets have done studies at UCD vet school, and they're carrying Borrelia, Anaplasma, Rickettsia, Babesia, and others. So, and they're biting the animals and making the animals sick. And we need to understand that they're probably doing the same to humans. Next slide. So these are the other species of Borrelia. The common ones in UK, Ireland, and Europe are Afzelii, Guerinii, and we've had a case of relapsing fever borreliosis, Miyamotoi, identified from a tick from an animal in Ireland. So I'm sure there's lots of other tick-borne infections throughout Europe that have not yet been discovered. And our understanding of these diseases is very primitive. Next slide. So Lyme disease, we're not going to go through the findings there, but Babesia is also another infection that people are being infected with. Ehrlichia is another infection that people are being infected with. Next slide. Bartonella. Bartonella comes from ticks, comes from sandflies, come from cats. I recently got a report that has been isolated in mosquitoes. So we're just not talking about ticks. We're talking about vector-borne infections. Mycoplasma chlamydia can come from a tick, can come from other sources, from respiratory exposure, but it causes similar syndromes, and it can mimic Lyme or can coexist with Lyme. And then there's the issue of viruses. We don't understand the roles of viruses in some of these very symptoms that people present with, similar to Lyme. Next slide. So ticks are all over the European Union, and this is the distribution of the different ticks within Europe. Next slide. So people are bitten by a tick. Interestingly, only 15 to 50% of people remember being bitten by a tick, and only 40 to 60% people recall a rash. So the clinician who says, "Oh, did you see a tick? Did you see a rash?" They're probably missing 75% of the cases. Next slide. And we know that the testing is imperfect. We now have COVID to compare. 58% of people who have COVID, within 2 months of their COVID antibody test goes negative. So you can have a negative test and have an infection. So the test is not 100%. We all know that, but we need to kind of teach the medical community that Lyme disease is no different and co-infections are no different. Next slide. And then this is just a slide that I got from Christian Perron looking at the sensitivity of the tests for Borrelia. So it varies from 20 to 97%. So Lyme is a clinical diagnosis supported by a good history, epidemiology, and tests can be helpful, but tests are not necessarily diagnostic. Next slide. And then if you don't treat Lyme, what happens? 6 months, 12 months down the way, this is a slide that goes, an article that goes back to 1987. So if you don't treat Lyme, 5% of people will show up with heart block, 10% with neurological problems, 60% with arthritis, maybe not in a week or two, maybe not in a month or two, maybe months and months later. So missed Lyme diagnosis will end up being seen by a rheumatologist or a neurologist or a cardiologist because Lyme is not considered in the differential. Next slide. So I think my key messages are early treatment is key, but you have to diagnose first. And then the NICE guidelines are only giving an indication for early infection. And we know there is no recommendation for chronic infection. And treatment for other infections, if you catch it early, for example, Q fever, 4 weeks of doxycycline does the job. If you catch Q fever a year later, it takes 18 months of combination antibiotics, but there is no such guidelines for chronic persistent Lyme disease. And it's a big challenge to get that over the line. The RCGP Lyme disease course states that antibiotics should be repeated until all symptoms cease. And then, like I said, if you have chronic persistent Lyme disease, even if you do catch Lyme and treat it, 10 to 20% of people will have persistent symptoms. And then people debate whether there's persistent infection or whether this is post-infectious. And there's convincing evidence and studies that have not been included in UK and Irish guidelines that in some cases, if not many cases, there is chronic persistent infection. Next slide. So given that, do short-term antibiotics always work? And the answer is no. And these are the studies. These are studies to show that 25 to 71% of patients, don't respond to later stage disease with short course antibiotics. And these are the PubMed articles that are available if people choose to look and find them. But unfortunately, those articles have not been included in either Irish or UK guidelines. So people have cherry picked, in my opinion, people have cherry picked the PubMed articles they want to include in their guidelines. Next slide. And then what happens if you don't get treated? These are the conditions, clinical manifestations, which you are all aware of. And I'm not going to go into details on those in the interest of time, but they're well described in articles dating back to the 1990s, if not the 1980s. Next slide. So my approach to treatment, really, and still in Ireland, they're given 2 weeks course of doxycycline, saying it's 100% curative. And if you're still sick after 2 weeks, or you get better after 2 weeks, and then you get sick after stopping the antibiotics, people say, well, the guidelines say you don't treat any longer. But for every other infection, you treat longer. If people get treated, they get better. And if you stop, you get worse. So my approach is to use clinical judgment. Second off, it's not all about Lyme. There's co-infections. So sometimes the co-infections can overlap in terms of the symptoms of Lyme disease. And there's no recognition, let alone testing available in the UK and Ireland in the public sector to check for these co-infections. And then my approach is chronic infection, Q fever, for example. If it's chronic, you treat for 18 months with combination antibiotics. And my approach is similar with Lyme disease. Longer course of antibiotics, combination antibiotics are required. And my experience is they work. And so current guidelines don't address the issue of chronic persistent infection. But it's not just about the infection. These infections are immunosuppressive and the immune system is damaged. And if you have a damaged immune system, it's difficult to clear infections. So I discovered that it's not just about the antibiotics, because I treated people with antibiotics early on, they got better. And then when you stop the antibiotics, they get worse. So my patients taught me that some of these other non-traditional treatments made a difference in terms of getting people over the line, in terms of improving their outcome. So my approach has developed over the years based on my observation of how people responded to my antibiotics, how in some cases they deteriorated when I stopped the antibiotics. And then and like I said, I think we have to learn from our clinical experience and observation as we treat patients. Just interestingly, there have been studies on chronic chlamydia, pneumonia, arthritis. And if you treat people with chlamydia, arthritis for 2 months with doxycycline, they get better. And when you stop, they get worse. But if you treat them with 6 months of doxycycline plus rifampicin, they get better and they stay better. And they've actually done studies to prove this. They can stick a needle into the joint, isolate the chlamydia pneumonia bacteria before and after treatment. So there's good models for longer course treatment and combination treatment in infections similar to Lyme disease. Chlamydia pneumonia causes a similar condition, but there's not good studies, to be perfectly honest, with chronic Lyme because it's not well recognized in the medical community. Next slide. So what's important? History, history, history. I treat people based on their history. Lyme usually has multi-system involvement. The ECM rash may be missed. The tick, you wouldn't see it if it was in the back of your neck or in the crack of your bottom, which very often it is a clinical diagnosis. Laboratory tests are not always needed. Early treatment obviously is the key. So we need to get GPs online to understand that you don't need an antibody test, understand that the ECM rash is not ringworm or is not a dermatitis. And then we should also treat patients and realize that if you respond to treatment and then relapse, for every other infection, clinicians retreat or give another course of antibiotics. And I think this is a standard of care in infectious disease for all infections, unfortunately, but Lyme. But the guidelines say no, and I think we need to find ways to change the guidelines. Next slide. So this is the classic slide, integrative care. It's not just about the antibiotics, it's critical, but lots of other things can affect your immune system and affect inflammation. So I think there's 3 key parts to treating chronic Lyme infections: infection, inflammation, damaged immune system, the 3 I's, and that really is the critical part for me. Next slide. So in addition to antibiotics, low-dose naltrexone is something that helps support the immune system, blocks the inflammatory receptors, repair the immune cells by acting on toll receptors. I don't work for any company, so I prescribe immune supplements. In Ireland, they have a product called Revive Active, probiotics, turmeric, N-acetylcysteine, and there's lots of other companies that have products to build up the immune system and decrease the inflammation: Nutrined, Make Well, Cowden Protocol, the Revive products. I've collaborated with Napier's the Herbalist, and there's a new company called Just Herbs that have a combination of products to support the immune system. And all of these products help, in my opinion, in combination with antibiotics. Next. So this is the Just Herbs product, and this is the Sublime Essential that's been put together. And I'm using products like this after I've completed treatment of patients, because I used to just treat them with antibiotics and stop the treatment afterwards. And many of the patients relapsed because the infection wasn't 100% gone. So my experience now is that I continue some kind of natural treatment after I finish the antibiotics in combination with the LDN. I do think Lyme and co-infections are curable. They're bacterial infections. I don't think people have these conditions for life. If they come back, it's because you never killed the bacteria in the first place. Next slide. And then there's a product called Sublime Vitality, which is actually a combination of basically the Revive Active, the Revive Mastermind products that is available now. So there's lots of products that are available, and this is a product that I'll be utilizing for people in combination with the antibiotics, or could be used before people start on the antibiotics. So I think, next slide. This is a complex infection. It's infection, a damaged immune system, and inflammation. I think people miss the diagnosis. In some situations, they're being misdiagnosed with chronic fatigue, fibromyalgia, atypical neurological syndromes. Not every case of fibromyalgia is an infection, but it should be entertained. The testing is imperfect. People go to other countries to get non-accredited laboratory tests done. I don't know why they're non-accredited. It's just a terminology that's used in the UK and Ireland. So I think we should embrace new technologies to make the diagnosis. And then, like I said, Lyme is just one of many infections. And I think most clinicians now are calling this condition polymicrobial infections, not just Lyme disease. And then ultimately, I think bacterial infections can be treated and cured with antibiotics. Longer-term bacterial infections require longer-term antibiotics. And then there is no recognition of chronic Lyme. So I think we should actually think about calling it long Lyme, just like we call it long COVID. And maybe the experience of COVID that the world is now experiencing will put chronic Lyme infection, back on the radar screen, because I see lots of similarities between the both. Okay, next slide. So it's complicated. It's a very complicated system. We don't have good research. We need better research. In the meantime, I think we need to do the best we can until we have better studies and support patients because I think this is a real, condition that is affecting many more people than we're aware of. So I'll stop now and give Monica time, and then we'll have time for questions. Thank you.
Thank you very much, Professor Lambert. So I'll hand over to Monica, if that's okay, Monica.
Yes, thank you. Hello, everybody. I'm just going to share my screen with you and get up a presentation as well. So let's share here, and hopefully, can everybody see? Loading. Come on. Can everybody see that okay?
Yep, can see it.
Yep.
Yes.
Great. Thank you very much for inviting me to be on today. And I just wanted to talk a little bit about the herbal approach to Lyme and Co. And all the co-infections there. Firstly, oh, why is it not? Sorry, just next slide. I don't seem to, here we go. I just wanted in one slide, for those of you who've never done herbal medicine or don't know a lot about herbal medicine, just in one slide to sum up the logic behind herbal medicine, because I'm sure that some people still think it's just, old ladies behind hedges doing sort of, strange things with herbs. But the fact of the matter is that plants evolved millions of years before us, shortly after viruses and bacteria. And over millennia, they've developed incredible biochemistry in order to look after themselves. So classically, to attract things to them, you've got to remember they can't move, so they have to manage the environment around them through moving to take it off. And significantly, from our point of view, they can't protect themselves from harm. No self-respecting plant likes a pathogen, and they can tell the difference between the good ones that surround them, for instance, the rhizobiome, which is so like our own microbiome, and the bad ones. But they do lots of other things as well. And this is purely for their own benefit. But as we've evolved afterwards, we get to benefit from that too. So I've been working alongside Dr. Lambert for over 2 years now. And, and it's been, a really great journey. Antibiotics do reduce bacterial colonies, there's no doubt about it. And with Lyme, you see that with some people, they have tried for years and years and years to shift it. And the combination approach of antibiotics does start to make a real difference. But it's not a short-term strategy. And there's a lot that herbal medicine can do to support that. Now, in the short term, when people can't, when people have just been bitten, if we know about it fairly straight on and somebody's just given doxycycline, there are certain herbs that we can give alongside doxycycline to potentiate and enhance that particular antibiotic, so that if somebody's only going to get a very short NHS treatment, we can help them to try to make the most of it. There are other things, for instance, most people who've got an elderly relative will know that you should never take grapefruit juice if you're on something like warfarin, because it enhances the uptake. We can use a lot of citrus extracts in medicines in order to enhance the penetration into the body's tissues. I would say, though, that you do need to know quite a lot about this. And, so I'm just trying to explain how, what the overall approach is rather than recommend specific strategies. We work with a few doctors who have patients that they're giving antibiotics to. Some, real specialists like Dr. Lambert, but also occasionally a GP, a more open-minded GP. And patients aren't just on antibiotics. Very often they're on a lot of other drugs as well. So one of the first things we have to make sure is that we do no harm. So we check all of the herbs that we prescribe alongside interactions checkers to make sure that there's not likely to be any side effects caused by the combination treatment. Easier said than done, because there are gaps in the research. And as Jack was saying, you know, reducing inflammation and supporting the immune system are two core pillars of the approach to Lyme as well. And the interesting thing about herbs is that they can also target inflammation, not just systemically, but in specific parts of the body as well. You know, some will, you know, choose to reduce inflammation in epithelial tissue, like marshmallow and things like that. Others will target the joints. So with herbal medicine, we can be a lot more focused. It's the same with the immune system. It's not enough just to sort of boost the immune system. A lot of people with Lyme are also, they have like a hypervigilant immune system, which can lead to all sorts of over-the-top immune reactions. So we choose the right herbs to make sure that the, you know, that all parts of the immune system are in perfect balance, which stops flare-ups and reactions, but strengthens and modulates at the same time. And importantly, you know, once the antibiotics are finished, we can use some of the antimicrobial herbs to help to reduce the likelihood of recurrence or relapse while the immune system is still recovering. You know, it's a long journey. What about patients who can't get antibiotics? Well, there are herbs that have been shown to be antimicrobial and specifically against, you know, Borrelia, Bartonella, Babesia, and many of the other co-infections. And as a research herbalist, I'm constantly reading papers to see where things are and trying to apply for government grants to get more research done because, you know, there isn't enough research. The ones that I primarily use are Cryptolepis, which I source directly from herbalists in Ghana so that I can be really sure about the quality. Japanese knotweed, an invasive species in Scotland here. Black walnut, Chinese skullcap, and South American cat's claw. But there's a lot of papers that show a lot of other compounds are also antimicrobial as well. I like Cryptolepis in particular because in vitro slides, whereas some of the others reduce the bacterial colonies in some forms, Cryptolepis is the one that really blacks everything out. What you have to remember with herbal antimicrobials is that they work at a slightly slower time scale, and we never use them in isolation. We always support the body at the same time. And I would encourage people who are buying over-the-counter herbs not just to focus on the antibiotic herbs. You can create damage in the body if you don't balance things well. You know, coldness, leading to sort of colder conditions, and you know, do be careful with the way that you use them. And for anybody again who is new to herbs, I just thought I'd show you just a handful of the studies that support the antimicrobial action of these herbs. They're all out there. However, for us as herbalists, good health is more than just the absence of bacteria. One of the things about, you know, Lyme is that it's not just about the symptoms that Lyme creates as well, but it's also, you know, it triggers symptoms, it aggravates existing conditions, the symptoms lead to other related conditions, and it can leave a lot of damage behind as well. And when you're looking at Lyme, it's not just always about Lyme and co-infections. Sometimes it's about Lyme and co-conditions as well. And what is interesting is that when you actually take time with patients to look at exactly what's going on, there are very often patterns. And some of these patterns go back for thousands of years in Chinese herbal medicine. The invasion by pathogens, or called Gu syndrome, recognize patterns of illness which to this day are so like those that appear with Lyme and Borrelia and things, before anybody ever had a microscope and could tell you what the infections' names were. So we look deeply and we look at restoring the balance in both the, you know, in the blood, in the liver, the kidneys, all the systems of the bodies. So I just thought I'd just briefly take you through just a couple of them. You know, it's a huge subject and very difficult to do justice to in 10 minutes. You know, Lyme carditis, you know, Lyme can really affect the heart, but it's more than just the heart in itself. Sometimes it's the whole of the blood system. If you look at the blood tests, if you know, when you get them back from Armin, you know, very often the red blood cells themselves have been disturbed. They're not carrying as much oxygen. You know, people have shortness of breath and then chronic fatigue. Sometimes it's an iron or B12 deficiency. And sometimes, you know, we just use blood tonics, herbs that are known to enrich red blood cells. Sometimes people's blood becomes thick, where there's stasis in the body, and that leads to, you know, additional migraines and headaches, particularly with people who get the very stiff neck symptoms as well. And we look to, you know, to keep the blood moving and to make sure that it doesn't cause a lot of other aggravated problems. And some of these infections are really nasty. You know, they actually cling to and crawl along like a child on monkey bars, the inside of the blood vessels. You know, that can cause, you know, disruption in the blood vessels too. But again, you know, once we understand what's going on, you know, there are different herbs that can be used. And of course, most scarily for a lot of people, you know, the classic symptoms of palpitations and racing heart and ectopic beats, you know, all of those trips to the emergency room where you think you're having a heart attack, and after you've been on a monitor, they tell you that you've been having a panic attack and go away and take some tranquilizers. Liver and elimination is really important. One of the things that I find is a lot of people know about liver detox and eliminating that way, but that's only one part of it. You know, as bacteria are killed off by the antibiotics, they're not all conveniently returned to the gut to be eliminated that way. You know, there should be more emphasis on the lymph, on lymphatic clearance. You know, so many people afterwards are still left with, you know, swollen enlarged glands and, you know, occasional sore throats and things where lymph hasn't been clearing everything. You know, the bowels are important too. And a classic thing with Lyme is very often that people just don't have enough peristalsis as the vagus nerve becomes infected. So again, you know, we can tailor a range of things to help them. And the skin, of course, the skin is a really large detox organ, and one of the ways that the body tries to throw off infection. And for that, you know, very often when people are going through the sort of stage of spontaneous day sweats and flushes and night sweats, you know, we can use diaphoretic herbs, which just help to make the patient a lot more comfortable while the antimicrobials are cooling the body down. You know, energy and, you know, and your memory, and, you know, tied to that, the ability to sleep too. You know, there's a lot of adaptogens out there, and a lot of patients will already be taking some sort of adaptogens when they come. But they may not be aware of the differences between them. And in some cases, people are taking too high a dose of some adaptogens that will overstimulate them and cause, you know, crashing, the sort of dolphin-like effect with energies. And in others, somebody would just be better suited to something different. But they can certainly help to, you know, to increase energy, to improve oxygenation in the body. Things like Arctic root, rhodiola, Dr. Lambert prescribes a lot. You know, eleuthero is also another one that was very much used by athletes training for different events, cordyceps. And also herbs that help with microcirculation to the brain, and very importantly to support sleep, because without good sleep and disrupted sleep, you know, energy cannot be maintained. We also look at the neurological system, because this is one of the areas that can very often be disrupted and be left post antibiotics, with people finding it, you know, difficult to do up, you know, to do up their buttons and manage. You know, it's a well-known fact that, you know, a lot of neurological damage can be caused not just by bacteria, but viruses as well. You know, I mean, outside of Lyme, people will know the damage that things like shingles can do, for instance. And, you know, nerves left on their own will take about 18 months to heal, but there are herbs and, you know, the brilliant lion's mane mushroom that can really help to speed up the healing. And, you know, it's always such a joy when somebody can actually feels they're getting the strength back, or the tremors are stopping. you know, tremors and seizures in particular can be very frightening. And then there's pain management as well. And, you know, that can very often, you know, people will be taking a lot of different painkillers, and it's a question of making sure that nothing that you do will ever, you know, over-sedate the patient, for instance, but, you know, trying to help them to reduce their dependence on chemical painkillers by raising the pain threshold and making life more comfortable. The gut is a really important area, and, you know, there's such a wide range of conditions there that I couldn't really sort of break them out. But needless to say, people are, you know, coming with everything from acid reflux to IBS and SIBO and Candida. And in some cases, antibiotics can really make the gut very uncomfortable for some people. In other people, they actually feel better than they have for years on it. It depends what's been going on. You know, our founder, Duncan Napier, always used to say the seat of good health is the gut. And very often people who are slower to recover are people who've come to Lyme with pre-existing gut weakness, particularly IBS, or and also high stress levels, you know, can predicate people for that sort of moment where they might have had Lyme in their system for some time, but they reach a point where, you know, stress, diet, and other things, and they just collapse. So there's a huge range of herbs that will also treat the gut. And without going too deeply into too many other things, there are a lot of other things where we see Lyme affecting people. You know, thyroid, for instance, where, you know, ANA antibodies can be down one day, up the next, and back down the day after. You know, sinusitis, you know, if people don't get to the bottom of sinus infections, they're far more likely to have a relapse later on. And it, you know, it never ceases to amaze me how many different conditions can be implicated because of Lyme. So as I said earlier, you know, it's both a trigger but also an accelerator of chronic health issues, which is why we never try to look at it in complete isolation. Post antibiotics, of course, there's the job of making sure that low white cell counts are boosted up again, that weak collagen structures are strengthened too, that nerves get to be repaired, and that the immune system is kept strong. And again, this varies from person to person, but in general, you know, after somebody's coming out of complex antibiotics, it's generally another 6 to 12 months of healing. And for people who've been ill for several decades, sometimes longer than that too. I would counsel people to try to make really healthy conditions. There's healthy decisions. You know, choose wisely and carefully. Don't just look at things on the internet and jump at the first thing. You know, look really deeply at, you know, who's saying what, who's giving you advice, you know, what's their experience behind it. And try and find people, you know, really good doctors or, you know, functional medicine practitioners, or if you take the herbal route, you know, a good and qualified herbalist. And, you know, particularly for those people who have high anxiety, try to leave the research and the decision-making on the herbs to your herbalist. Try to trust them, because you need all your energy to do the things that we can't do. You know, I say to my patients, you know, I can do the research and keep you safe on the herbs, but what I can't do is come round, take you shopping, cook you really good healthy meals, put you in bed by 10 so that you get lots of REM sleep, you know, and go jogging with you. And I think at the end of the day, my sort of one message is that even if you've been struggling for a very, very long time, you know, there is definitely hope. I've seen people who've been ill for years and years and years get better. You know, so there is hope. Thank you all. And I will stop the share.
Thank you so much, Monica. That was really informative.
Very welcome. I hope I didn't run over too much.
That's absolutely fine. So lots and lots of people emailed us in with questions, and obviously we just couldn't ask the amount of questions that we've received, so I've picked a few. We can record the questions that are in the chat box and maybe get some answers for you all after the event. So I'll go to our questions. I'm not sure where Professor Lambert's gone. Are you still there, Professor Lambert?
I'm still here. I've actually been answering a lot of the questions on the chat box while I was talking. So
yeah, I saw you answering. I
was doing all of that. So I've covered I think most of the questions. Just sorry, Monica, I've heard your lecture before. Anyway, sorry. Anyway,
I'll try and run through a few of these questions, and like I say, we'll save the questions that are in the chat box and print them out, and maybe Monica and Professor Lambert will have a little look through them at their leisure after the event. So I think to round up both what you've spoken about today, I think the most important question to get in before we finish is, what are both of your go-to tips for self-help for people who just can't access a doctor who's knowledgeable with Lyme disease, or a practitioner who are just on their own? What can they do to help themselves?
Okay, so I mean, when I see patients, well, right now I'm seeing patients in Ireland. People in the UK currently can't come and see me because of travel restrictions. And when they do come to see me, they're already on some kind of supplement. They're already on turmeric. They're already on, a number of different agents. And I do think these bacteria are low-grade pathogens, and they are controlled by the immune system. So I think by repairing the gut, your gut is your immune system, by having a series of immune boosters and anti-inflammatories, I think people improve clinically without antibiotics with these conditions. But I still get back to the point, as an infectious disease specialist, I don't think these infections are 100% eradicated until you actually target the bacteria with antibiotics. So I think there's lots of things you can do, and I'm not going to talk specifically, but I think there are things you can do to repair your immune system and manage the symptoms before you can get an appointment, before you can get support. So that's just one comment. Monica?
Yes, I would agree with that. I think, though, that, when people are doing self-help, and, many people come, they've been following the Boona protocol or the Cowden protocol. There's a lot of information that's out there and available. But I think, as I hope I explained in my slides, you really need to take a very holistic look at it. You can't just treat Lyme, in isolation by trying to kill the infections with antibiotic herbs. You do need to look at supporting your immune system. You need to look at dietary changes. You need to look at anti-inflammatories as well. But people can come a long way. But I very often find that without specialist help, that people are more likely to have relapses. People will say, I did quite well on the herbs when I was self-treating myself, but then I relapsed, or you just don't sometimes always get out of this loop. And with we have 8 herbalists specializing in Lyme at Napier's now, and really I spend a lot of time trying to reach out to GPs and doctors as well. Very often, if a patient has a GP who has only given them one course of doxycycline or something, I will actually write to the GP in as friendly way as possible, saying that I've also seen this patient and reviewed their tests, and I would like a second month of antibiotics where it's appropriate. So you can also, your practitioner can also be a champion for you too.
Okay, next question. Actually, you've both touched on a lot of questions that people have asked throughout your presentations. So this one comes up regularly, I see, on forums. And I think you've both touched on it, but it'd be good just to hear from both your experiences. Do you feel that anyone is ever completely cured of Lyme disease, or is it just about keeping the disease in remission?
Right. And I think I already focused on this. Bacterial infections can be cured.
Good.
End of story. If you don't cure them, it's because your immune system let you down. You know, so I used to have patients who were HIV, and we used to treat them for bacterial infections. And as soon as we stopped the antibiotics, the infection came back again, because you suppressed the bacteria 99%, but not 100. You didn't kill it off 100%. When the HIV treatments came along to suppress the HIV virus so that the white cells went back to normal, HIV damages the lymphocytes. When the lymphocytes went back to normal, then a normal immune system of an HIV person on treatment plus the antibiotics eradicated the bacterial infection. So just using that as an analogy, I think this concept of I'm always going to have Lyme disease for the rest of my life and I'm in remission, my observation and my belief is that bacterial infections can be 100% killed with bacteria, with antibiotics, if you can repair the immune system. So I just think that is basically a basic concept of infectious diseases. And I think people should go with that rather than just believing that they're going to have this chronic condition for the rest of their life.
Anything to add to that, Monica?
Yeah, I sort of look at it in the same way. And, very often I say to my patients, it's not whether or not you can actually get rid of it entirely or not. We just don't know. We don't have the scanning or the scanning equipment to be able to see that every trace is out of your body. But to be quite honest, we need to stop thinking of ourselves as just single entities. Each one of us is a universe of all sorts of bacteria, viruses, phages. We're finding out more and more and more about what lives in our gut. And it's not just that, it's, we have a lung microbiome, a sinus microbiome as well. And when your immune system is strong and you're healthy, none of that bothers you, and you can keep, your immune system is perfectly capable of managing, low bacterial loads. Everything comes a cropper if there's a high bacterial load. But, we all have some Helicobacter living on us. We all have some Staphylococcus living on us. I've been looking at papers of people in working in forestry from the 80s and 90s and 2000s when Lyme first, came on the radar from the States. And what was interesting was that on average, about 20% of people working in forestry tested for Lyme antibodies, and that was using the NHS type ELISA test, but only about 3% had symptoms. So very often it's a perfect storm that creates the manifestation of the illness. And I do believe that that even if it's not completely eradicated, people can live perfectly healthy lives without remission, but they do need to look after themselves.
Okay, thank you. Another question that came up. If a patient doesn't get better using a combined approach of antibiotics and herbs, do you both feel that there might be other factors at play outside of a main infection?
Well, see, the thing is that, like I said, we talked about Lyme disease. This is not Lyme disease. This is polymicrobial infections. And if you look at the ticks in France, they're carrying viruses, bacteria, fungi. They're carrying all sorts of different infections. It's really early days, And there's a group at Oxford that have been looking at patients with chronic fatigue syndrome, and it's interesting that they've done PCRs in the blood, multiplex PCRs, so they're identifying lots of bacteria, viruses, fungi in the bloods of patients with chronic fatigue, and they're not seeing it in a matched control. The issue is, are these bacteria, are these viruses, are these fungi, are they playing a role in the symptoms of the patients. And one of the things that we're interested in doing is actually putting people on treatment and rechecking the PCRs on these patients' bloods after we've given them treatment. We don't have a good understanding of these things, and not everybody that I treat gets better. So when I see patients, I say, I think there's an underlying active infection, and my observation is 60–70% of people will respond to the antibiotics. If they don't respond, then it's maybe there wasn't a live bacterial infection there. Maybe there was something else there, or maybe it was post-infectious. Maybe it's just inflammatory and autoimmune. Maybe the bacterial infection has gone away. So unfortunately, there's not been good research in this area. I mean, historically, in America, they've given $5 million to Lyme tick-borne infections at a time when they were giving 1.8 billion to HIV research. We don't have good studies, you know, and this is really the challenge. And even my observation, I'm editor in a couple of journals now, and even the work on disulfiram, early work on disulfiram, people mentioned this. It was almost impossible to get the study on disulfiram, the phase 1 study in the 70 patients that was done recently, to get it published, because some of the reviewers just didn't want it published, just rejected the publication, saying it wasn't of scientific merit. So there's huge challenges. There's no funding to better understand these conditions. And even when there's data that's available and we try to put it into the scientific literature to get it on PubMed, it's rejected. So there's huge challenges that we're meeting here. And I think we are beginning to overcome them, but it's really a black hole, I hate to tell you. And lots of clinicians are out there trying to do their best to treat patients, and lots of patients are out there trying to do their best to kind of support themselves. And until we have better science and a better understanding of what's going on inside the cells, what's going on inside the tissues, what are the bacteria in there, what are the viruses are in there, you know, we're going to continue just to be in this situation, doing the best we can. We need an investment in more resources, more science, more openness in the medical community to understand these complex illnesses.
Anything from you, Monica, or just?
Yes, well, I mean, just going back to the question was, you know, is it sometimes other conditions? And earlier I'd said that, Lyme can be a trigger, or an accelerator of conditions. And, I'm minded very much thinking about some of my patients who have a twin brother or sister, where one has Lyme and the other doesn't. And that's quite interesting, because you can see the genetic or familial family inheritance in both the infected twin and the non-infected twin. But at the same time, all the manifestation of their genetic condition is so much worse when somebody has Lyme as well. So, Lyme can be, in isolation. Some people are perfectly healthy and they just they have really bad luck. They get bitten by a really nasty, dirty tick that's full and have, a lot of bacteria, and they go down. With some people, they do have other conditions, and the Lyme is just the don't mean to say the icing on the cake. What do I mean? The last straw.
Final straw.
The final straw. Thank you.
Okay, well, we're sadly running out of time, and I know Professor Lambert needs to get back to his clinic. As we know, we're here today to talk about both our speakers' collaborative approach, but we have been inundated with questions about whether having Lyme disease is a risk factor for COVID-19, and whether Lyme disease sufferers, if there was any opinion on whether you should have the vaccine or not. So I think Professor Lambert was happy to comment on that.
Right, and I did put a chat message regarding this. So people say, well, I'm a Lyme sufferer, my immune system is low. But then people with HIV have a low immune system as well. And I'm just, But so I don't think Lyme in of itself is a risk factor. Age is a risk factor, obesity is a risk factor, diabetes is a risk factor, blood vessel disorders, you know, hypertension, or other conditions are a risk factor. So I think that really is the major issue. But then again, if you wash your hands religiously and wear masks or 2 masks or more, you won't catch COVID. So I wash my hands every time I touch a surface. And I religiously wash my hands. So I think, so I don't think COVID, you know, Lyme and COVID, you're not going to necessarily do worse, but don't catch it. You don't want to catch it, would be my advice. And then in terms of the vaccine, I get the vaccine and I'm a believer in vaccines. I've done a lot of work in vaccinology and I've seen the consequences of not getting vaccines, an outbreak of measles in Haiti and children with thousands of deaths because they didn't get the vaccine. So I'm a firm believer in a vaccine. The issue is that vaccines do stimulate your immune system. That's how they work. They stimulate antibodies and they stimulate T-cell responses. And if you had, so we don't know, this is a new vaccine. We've never had a COVID-19 vaccine and we've never had an RNA vaccine, mRNA vaccine before, but I took it and I think it's a good idea. If you've had problems previously taking the influenza vaccine and having a bad reaction, then I think you should be concerned that you might react badly to a vaccine and you should consult with your GP about the risks and the benefits, but that's all we can say. We don't know.
Thank you, Rick, for answering that question. Well, we're nearly up at the hour. It's gone by so quickly, but it's been amazing. And we've had, I think, not far off over 300 people viewing this event. I'm sure everybody who's attended would like to thank Professor Lambert and Monica for giving their time and sharing their extensive knowledge with us. If you've enjoyed this seminar, details of a follow-up seminar will be available shortly when Dr. Robert Bransfield, psychiatrist and clinical associate professor of psychiatry, will be speaking about his latest projects and taking questions afterwards. Many thanks to everybody who's attended today and to everybody who has submitted questions to the seminar. I'm sorry that we couldn't get through the many that we received, but we will save the chat box and see if we can get some other questions answered after the seminar. Thank you, everybody. Thank you, Professor Lambert.
Bye.
Thank you, Monica.
Okay, see you.
Thanks so much.
Okay, thank you. Bye.